Hi guys, welcome to Healthy Living with No Small, the channel where health finally makes sense. Welcome to series 4 of Healthy Living with No Small. This week we're going to be talking about stroke. Last week we talked about hypertension, high blood pressure, and how it can lead to stroke. So this week we want to look into stroke. We want to look into what happens. We want to look into the complications. We want to also look into how we can rehabilitate after stroke. So if you do know someone that is going through it, stay tuned and keep watching. Did you know that the lifetime risk of stroke has increased to 50% over the last 20 years? And 1 in 4 adults is predicted to experience stroke in their lifetime. That's right. And that's how serious the condition is. With stroke, time is of the essence, okay? Stroke is a medical emergency that occurs when blood flow to the brain is interrupted by either a blockage or bleeding. Okay, so it can either be from a blockage. Now the blood is not flowing to the brain, or there's bleeding in the brain itself. And this lack of blood flow to the brain can lead to serious brain damage and even serious complications. And that is why we say we have to manage the factors that lead to stroke, okay, or that even leads to hypertension, which is a main factor when it comes to having stroke. Now, there are different types of strokes, okay? And I'm going to break it down in easy ways. Like we said, we want simple information, right? Now, have you ever seen a person who had a stroke, right? Who had a symptom of a stroke, but they don't look like they ever had it? Good. That's a type of stroke. It's a very short stroke. Like it's a short, it only happens for like few minutes and it doesn't have any lasting symptoms or lasting effects. Okay. It's like a prelude into the stroke. It's like an introduction into the next one, because if it happened before, it can happen again. And that is what happens with stroke. And that's why it's very important to manage it. That type of stroke that lasts for a few minutes and doesn't leave a lasting effect is telling your body that you need to slow down. It's telling your body that you need to manage something better before the actual stroke happens. Okay. Now, the next one, or the other one that can happen, is when there's a blood clot that stops the blood from flowing through the blood vessels, right? That's another type of stroke. Now, there's another one where it ruptures. The one of the blood vessels ruptures, and then there's bleeding in the brain. Okay. Again, we have the prelude into the stroke itself, which is it lasts for a few minutes and doesn't leave a lasting effect or lasting symptom, or you don't see that the person ever had stroke, right? That's one. That is like telling you it's a warning sign. The next one, or the other type of stroke, is where there's a blood clot in the brain. Okay, there's a blood clot stopping the blood flow through the vessels, right? Now, there's another one where the vessels actually rupture and now there's blood in the brain. Okay, and that can lead to stroke. Let's talk about the risk factors. Like I said, are you at risk or am I at risk? Let's see. Now, as I said before in series 3 about hypertension, hypertension is one of the leading causes of stroke. Hypertension is one of the leading causes of stroke. People who have hypertension are 3 times more likely to end up with stroke than those who don't have hypertension. And that's why it's important to manage your blood pressure. Another risk factor to stroke is tobacco use. Okay, so avoid tobacco, avoid smoking. High blood cholesterol and high blood sugar with hypertension are always linked together. Okay, if a person has high cholesterol, they will have high blood sugar and then they will have hypertension. Okay, so they are linked together, and those are also risk factors when it comes to stroke. Overweight, being obese is another risk factor. It's important that you try to lose weight. If you know that you're overweight or you're obese, try to lose weight to avoid ending up with stroke. Okay. Physical inactivity, not being physically active enough, is not too good, and it can make a person end up with stroke. Okay. Try to work out at least 150 minutes in a week. Very important. 30 minutes. It's either walking or jogging, something where you don't have to do too much, right? Moderate physical activity is like, it's enough. Okay. Unhealthy diet, particularly diets that are high in sodium. Unhealthy diet, particularly diets high in sodium, can cause stroke. And if the diet is low in fruits and vegetables, not so great, right? So we want our plate to, look like a beautiful mix of colors. We want it to have fruits, vegetables, carbs, less carbs, portion controlling everything and eating healthy options. Harmful use of alcohol, excessive use of alcohol, use of illicit drug, overdosing is very is a big risk factor for stroke. It's a big risk factor for stroke. So avoid illicit drugs, avoid alcohol, very important. Air pollution can also lead to stroke. Yeah, strange, right? Air pollution can lead to stroke. So be careful of your environment where you are exposed to chemicals that you're exposed to can lead to stroke. Now, kidney dysfunction can also lead to stroke because again, your kidneys, what are they doing? Your kidney is washing out your body and taking away toxins that are in your body, right? Your kidney is doing a lot of work for you. Age is another risk factor. As I've said before, age is a constant contributor or a risk factor to most health conditions. As we age, our metabolism reduces, flexibility of the organs or even the blood vessels reduces. So, age plays a big role when it comes to a person having stroke. So, it's very important that as we age, we are taking care of our health, we're eating right, and doing everything that we need to do to avoid all of these health conditions. A prior stroke, and as I've mentioned before, it's a type of stroke can happen where it only lasts for a few minutes, doesn't leave any symptoms or any lasting effect on the body or on the person that had the stroke, but it's only a warning sign towards the next stroke that would happen. So if a person has had a stroke before, it's very likely that they will have that stroke again. Okay, and this time around, it can even be worse and leave a lasting effect than the first time. So if you've ever had stroke before, if you've had it one time before, make sure that you're doing everything that you can to avoid having it again because now you are at risk of having stroke for the second time. Okay. Pre-existing cardiac conditions, if you have any heart issues, any heart problems, it can cause a person to have stroke. I'm going to be putting the signs of stroke up here and you can see to be able to spot the signs of stroke. And as soon as you notice that this is a sign of stroke or something is not right in my body, you have to get help. Get to your doctor immediately, get to the emergency room because again, time is of essence with stroke. You have to get medical help as soon as possible. Okay, as soon as it happens, from the time it starts, you need to know when it starts, when that symptom started. If it started at 1 p.m., note that it started at 1 p.m. By the time you get to the doctor or to your hospital, you want to be able to tell them, oh, I started feeling the signs at 1 p.m. It's 30 minutes past, it's 60 minutes past. Because again, the medications or the therapy that they will give you, some of them are very time sensitive too. And so that it doesn't also affect the brain and affect other things, they can know what to do and what to give you. Okay. So as soon as you see the symptoms, start timing and get medical help immediately. Okay. First symptoms is balance, loss of balance. Okay. You feel like you're trying to walk or you're trying to move, but your feet are not, your legs are moving, are not cooperating with you. It seems like your movement is unsteady. You're losing balance. Okay, you can't coordinate your steps properly. That's one sign. Okay, your eyes, your vision, it's like you can't see. There's changes in your vision. Something is going on. It's affecting your eyes and you cannot see. That's as part of the symptom. Okay, and you want to get help quickly. All right. Now, another one is facial drooping. It can be left side or it can be right side. I'm putting another picture of what it can look like up there. Okay. What it can look like, facial drooping, left side or right side. The face would just droop, and then that would affect the speech. Okay. You begin to have slurred speech. The person can't speak properly. They're trying to make words and it's not coming out right. Okay. It's like they're mumbling. Okay, it's hard to speak or people can't really understand them because now the face is paralyzed to the side, to one side, and then the speech is slurred. The person's arm can lose activity in that arm. It can become weak. Okay, you begin to feel numbness or just weakness in the particular arm. It could be the left or the right. You just feel weakness, that face, that arm, entire side, the legs. It could just go weak, and so they can't lift it, they can't move it. It just feels week. Time is of the essence. Get to where you can get medical help as quick as possible. Okay, so those are the signs, and it's important to get medical help as quick as possible to avoid long lasting effects. Stroke can lead to a lot of complications, other complications that we can see and the ones that we can't see. The first one is active swelling in the brain. Okay, there will be swelling in the brain. Swelling in the brain can happen with someone who has had stroke. Okay, a speech disorder is another one. Okay, speech disorder is another one where again they're having slurred speech, they can't speak well, their brain can't coordinate what they're saying, depending on where that stroke is affected in the brain. Okay, trouble swallowing because now again they have special paralysis, the speech is slurred, it's hard to kind of digest anything, and they can have what we call dysphagia, which is having issues swallowing. Dysphagia means having issues swallowing, being unable to swallow properly, right? Just because the muscles that are supposed to help with the swallowing over there also have been affected by the stroke. Okay, seizures, a person can end up with seizures after stroke because again everything is happening in the brain, and the brain is this brain is sending different signals, all right, to the body. If the stroke has affected a part of the brain that causes seizure, then it's going to happen, right? Exactly. Depression can happen. Depression can be alone because again now the person is paralyzed. It could be a right side, left side, they can't do much. They have to depend on people to help them with the activities of daily living, right? Someone who used to go to work, and someone who used to be so hardworking, and someone who used to have to do everything themselves end up with stroke. They get so depressed that they have to depend on someone else. Okay, so be kind to those type of people, be nice to them, check up on them, speak to them, encourage them. It's very important. Okay, it's very important to also get help where it's needed. They can also have pressure ulcers. Pressure ulcers are can happen from just laying in one position and not being able to move. Again, remember that these people are paralyzed now. It could be on the leg, it could be the arm, it could be an entire part of the body. And so they can't do much. They can't turn on their own. They can't do so. Just laying in one place for a long time can cause pressure ulcers. And those pressure ulcers, they look red. It could end up with blisters, it could open, and it could become even worse and get into the bone. Okay, so if you know someone who has stroke, or if you're taking care of someone who has stroke who can't move themselves, it's important that you turn them, say every 2 hours, turn them to the left, turn them to the right, let them get up, help them to the chair if it's possible. Okay, help them to move around. Don't just let them lay there, because it's easy to lay there without moving. It's more easy to lay down without moving and having to stress the part that hurts or the part that is uncomfortable, right? So that's another one. Hands and legs will contract. The hands and leg will contract because again, there's paralysis. So some of them just, they might keep that hand that way, or they might keep the leg a certain way, and there's just contraction of the hands and the legs. It's nothing that can be done about it because it has happened and it has left a lasting effect. Muscle spasm, they start having like the muscles will just contract. It can be very painful. The doctor can decide to put them on medication. Shoulder pain from that paralysis or from the stroke that affected that side of the body, or the other side of the body. It really depends. Shoulder pain can happen. Inability to perform activities that they used to do before. The inability to perform activities that they used to do, like I said, can lead them to depression, can make them unhappy. It's very hard. Those are complications of having stroke. Okay, so again, it's important to take care of your health to avoid these type of issues and conditions. Abnormal movement, meaning their legs, even when they try to move, the movement can never be the same until they get therapy, or they get occupational therapy, or they get help, to try to get them to walk again. Inability to hold urine, and because a person has had stroke. Okay, because a person has had stroke, the muscles that kind of hold, that help them to hold the urine, has become weakened. And so they start having what we call incontinence. They're not able to hold in urine anymore. And so they start peeing on themselves. Okay. And you find that some of the people who have stroke, they either have diaper on, or they have, like, some of them, if they are home, they have like a Foley. They put in a catheter, a bag that helps them to drain. It's a tubing bag that helps them to drain the urine. Or they just have a diaper, and diaper needs to be changed. And you see all of these conditions, all of these things that putting on a diaper and having, for someone who has never had to be in that situation, it can be sad, it can be depressing. And so it's important to encourage them, help them get, see a therapist that can help them walk through all of these feelings that they're going through, or if they have families that can just be there for them and support them and provide help and encourage them. That's very important to do as well. Prevention. The same things that causes stroke are the things that we need to prevent. We need to stop to avoid ending up with stroke. Again, managing your blood pressure. If you're able to manage your lifestyle and are able to effectively manage your blood pressure, you can reduce the risk of ending up with stroke. Okay, avoid alcohol consumption, tobacco use. Being exposed to it as a secondhand smoker as well can lead to stroke. Okay, so avoid places where they're always smoking and you're always having to inhale it. Okay, avoid places where there's air pollution, chemical pollution, exposed to chemicals, and you're inhaling. Okay, so avoid those type of situations as well. Adopting a healthy diet, a healthy lifestyle, physical activity, no matter how busy your life can get, spare 30 minutes in the day. Okay, spare 30 minutes in your day to work out, to get in that physical activity, because over time it will do you a lot of good. Okay, reduce salt intake, include fruits and vegetables in your diet, actively manage any underlying conditions, anything that you've had before. If you've had other health issues before, manage them properly. If you have hypertension, manage it properly. If you have high blood sugar, manage it properly. If you, whatever conditions that you have, manage it properly. Take your medication, follow your doctor's advice, okay, and limit use of alcohol. Limit your use of alcohol. Very important. Okay, and improve your indoor and outdoor air quality. Improve your indoor and outdoor air quality. Avoid places where there's air pollution, as I've mentioned before. And you can reduce, by doing these things, you can reduce your risk of getting stroke. You can, after stroke has happened and we've tried to prevent it, but the person still ends up with stroke. A major part of all of this is how the person, comes back after the stroke, how the person regains themselves after the stroke. And that's why it's very important for a person who has had stroke to go through stroke rehabilitation. And we want to involve occupational therapy, where they are helping the person move again, get up and use their legs, use their arms, being able to do things by themselves. They want to get them to that point. Okay, they want them to see someone that can work with their brain and see how their brain activity is going. Neuro, right? The brain activity, being able to speak. Speech therapists, they're going to need a speech therapist, someone who can help them relearn how to use their speech and how to speak again with their mouth. It's difficult, but it's very possible. And so it takes a lot of work, right? Stroke rehabilitation is a very critical component of the person's recovery. Okay, it's very important that they undergo this in the first few days after the stroke. Okay, so after the stroke has happened and they've gone to the hospital, they need the doctors will refer them for stroke rehabilitation, seeing an occupational therapist, speech therapist. Okay, a physiotherapist as well, to help them with being able to move, their balance, coordination. That will be a physiotherapist's job to do. And so that person will be working with a bunch of people. It's a lot to see a bunch of people and a bunch of different people, but it's also for their own health and for them to recover to the best of, to the extent possible. Okay, we can't say there will be 100% recovery, but we can say that there are chances of recovery when we do all of this. Now, we've come to the end of series 4 and we talked about stroke. If you found this video helpful, please like, please subscribe, click the button below to subscribe, turn on your notification, and share this video to help create awareness about stroke, rehabilitation, how to prevent it, what puts you at risk. And I will see you in my next video. Thank you for watching. Bye.